Hey everyone, Dr. Gary Linkov here, double board certified. I'm a facial plastic surgeon and a hair restoration surgeon. This video is about Jada Pinkett Smith, and it also covers women's hair loss and hair treatment options for women in particular. So this will be an interesting one. I heard about Jada and her struggles and I wanted to talk about it here. We'll also discuss that scalp scar that she has. So make sure to please check out our hoodies. We have these great hoodies that we just came out with, and it's all about body positivity. It's our I Feel Beautiful hoodies. Check those out. Thank you so much for the support. Partial proceeds are going to charity, specifically to the Alopecia Areata Foundation, because that is the condition that I have and that some people think maybe Jada has as well. So let's talk about it. I'm going to play this clip. This was Jada on Inside Edition.
Jada Pinkett Smith shows the world she has no shame with a bald head.
At this point, I can only let...
So it looks like she recently just shaved her head.
Y'all know I've been struggling with alopecia.
She's pointing to that area of what looks like scar on her scalp and referring to it as alopecia. I think there's been a lot of misinformation about what type of alopecia she may have, and just to kind of define things, alopecia is just hair loss, and there are many different types, and we'll cover a bunch of them here in this video.
Shows how the hair loss condition, alopecia, has left her with a big scar on her scalp.
Inside Edition is even saying, you know, alopecia, the hair loss condition, alopecia is a very non-specific term. It's not an actual condition. There are specific types of alopecia.
Just all of a sudden one day, look at this line right here. Look at that.
So again, she's pointing out that scar on the scalp.
Look at that. And so it just showed up like that.
So she's saying that it just appeared, that this linear line that looks like it was probably something happened in that area. She's saying that it just appeared.
I've been getting a lot of questions about why I've been wearing this turban. Yeah. Well,
and you know, just like her, I mean, I also get questions about wearing hats and having surgical caps. And actually today I did a hair transplant, so I'm wearing my cap. But as you guys know, oftentimes I'm just without my cap and just bald, right? Because I have an advanced form of alopecia areata.
been issues with hair loss.
She even showed herself getting a buzz cut. Now she's completely bald.
Remember that she's bald because she shaved her head. There are still signs of some follicles there on her scalp, so she could choose to wear that hair longer. She chooses to shave it down. Just keep in mind with alopecia areata, especially with the more aggressive types like totalis and universalis, you don't really have a choice, I mean, other than taking certain types of pills and doing certain other things, but those follicles are actually being attacked by your own body. So there are no follicles that you can choose to allow to grow. They're being destroyed by your own body cells.
To avoid surgery rumors.
This is going to be a little bit more difficult for me to hide. So I thought I'd just share it so y'all not asking any questions.
The internet is loaded with...
They're juxtaposing what you're seeing here with this woman that clearly has alopecia areata, these kind of patchy areas of hair loss, with what Jada has. And I think that they're two very, very different things, and I'll talk more about that soon. You can't say everyone has the same condition.
Showing their hair loss due to alopecia.
So I have a bald patch over here.
Alopecia areata is a circular type of hair loss, and sometimes those circles can advance and merge into a bigger area.
I honestly felt like she hugged me when she made that post because it made me feel like I was not alone.
I think it's really courageous that she...
Oh, I was on the Dr. Oz show with this Dr. Wolfeld.
She's publicized it and she talks about it, and I think it really gives a lot of hope to other women that are out there that may be experiencing something similar.
I definitely think it's great that she's out here talking about her hair loss. I just want to hone in on what type of hair loss Jada actually has, and I think that would be useful information for everybody. And again, it's speculative. I'm not her doctor, but that's what I do for a living, is hair loss treatment.
This is my hair loss.
Actress Alyssa Milano recently showed off clumps of hair that came out after she was diagnosed with COVID.
Even so far in this video, they've already pointed out several different types of hair loss. They showed a woman with alopecia areata, and that is one type of condition. Then they showed this other celebrity who had hair loss after COVID. The type of hair loss there is called telogen effluvium, and that is something common after many different types of viral infections.
She remains upbeat about her ordeal.
Oh, Mama's gonna put some rhinestones in there. I'm just gonna make me a little crown.
Definitely she's got this area of what looks to me more like scar than just your natural type of alopecia type of condition. So we're gonna cover in this video what are the most common types of hair loss in women. I actually gave this type of lecture in a more detailed way at the Global Aesthetic Conference last year. We'll also touch on what type of hair loss Jada might have, what caused that scar that's on her scalp, what type of hair restoration options are available to women, and what can Jada do now that she has this scar area, and just for her hair loss in general, what might be the options for Jada. So watch till the end to find out. We're going to start with the hair loss in women. What are the different types? The most common type is androgenic alopecia. This is also sometimes referred to as female pattern hair loss. It's analogous to male pattern hair loss. The actual pattern of the hair loss is different, but the underlying reason or the mechanism of loss is still androgen based, which means that it's hormonal based. There are these male hormones called androgens, and they cause a miniaturization process to occur where your hair gets more and more miniaturized over time, and that can cause different types of appearances on the scalp. So for women, it's more of a central parting that we see. So we see a preservation of the frontalmost hairline, and then usually just behind that, there's an area that starts at the part line of thinning, and it starts to widen. It starts to widen, very different from what we see in men, where there's recession at the frontotemporal areas, and then there's loss at the crown or the vertex. It takes on a different pattern, but nonetheless, the underlying reasons are the same for the majority of hair loss, which again is called androgenic or androgenetic alopecia. Another type of hair loss in women is telogen effluvium. Now, this comes in an acute form and a chronic form. I mentioned telogen effluvium when we were talking about COVID and different other viruses or stressful events that can occur that can cause basically a shedding to occur. The hairs, most of the hair on the head, 90% of scalp hair exists in the anagen phase of the hair cycle, so in the growth phase. But sometimes it can enter into a resting phase and even a shedding phase. So that's the telogen and the catagen phases of the hair cycle. When that happens, you start to see shedding, and that can be like an acute type of problem, or it could be something that happens slowly over time. So it's another type of hair loss condition. Then you have cicatricial alopecia, which is a form of scarring alopecia. Now, this is very different from what we've mentioned before. This is where there's an inflammatory reaction, and the body actually starts to sometimes build up scar tissue in areas on the scalp, and then sometimes the hairs might never grow back. So that's cicatricial alopecia. Then you have alopecia areata, and this is an autoimmune type of hair loss that I mentioned earlier. This is what I have. I have the extreme form universalis, and there are other, famous people out there with this type of condition, some of whom, sport it, some of whom cover things up with a wig, some of whom take medications to try to combat it. And these are generally circular areas of hair loss. It's not that uncommon for people to have a spot of hair loss on their scalp or somewhere on their body, and then that hair grows in over time, and they never really think about it again. But in rare cases, it can expand. Sometimes the spot doesn't fill in at all. You have what actually they showed earlier. Then you also have this frontal fibrosing alopecia, another type of more rare kind of scarring type of condition, an inflammatory state where you have the hairline receding up in women. And there's been some speculation that maybe it's actually sunscreen lotion that might be contributing to this, but that's not conclusive, and some people agree and some people disagree. But also you get a thinning and sometimes complete loss of eyebrows with this condition, and this can be very difficult to treat. Then you also have traction alopecia as yet another form of hair loss. Traction alopecia is when you have tight hairstyles, like women who wear their hair back or in tight braids for extended periods of time. You can actually cause pulling on the hair that causes inflammation at the root or the follicle of the hair, and it can cause that hair to fall out. And that is traction alopecia, and you can get some thinning and balding in the front and on the sides because of this type of state. So the best treatment is actually to wear more relaxed hairstyles to avoid something like that. So please make sure to subscribe to our channel. We do a lot of educational stuff for you guys. We do celebrity reviews of different hair type of treatments that they may have had, or facial plastic surgeries. We also do a lot of reaction videos to other YouTube videos, and of course just purely educational stuff related to the work that I do in my surgical practice. So now let's go to the types of hair loss that Jada might have. Now, it's not uncommon for especially women to have multifactorial reasons or explanations for their hair loss. So I think that Jada has 3 potential explanations for her hair loss. I think one, there's probably some degree of traction alopecia that's happened over time. I was looking back through many photos over decades, and there are plenty of times when the hair is braided and the hair is stretched back, and that can lead to some degree of traction alopecia. I also think that she may have chronic telogen effluvium, and this again is worse in situations like COVID, but it really can happen from many different types of life stressors, including viruses, but other things can do it too. And I think she may have some component of androgenic alopecia. It is, at the end of the day, the most common cause of hair loss in women as it is in men, and that causes a miniaturization of the follicles. The hair starts as like a terminal type of hair, so it's nice, long, straight, thick, and then it slowly over time, as the androgens start to take effect in certain parts of the scalp, becomes miniaturized. It grows in shorter until it really doesn't even break the skin surface. So what caused the scar on Jada's scalp? Now, could it be alopecia areata? I think it's a bit too linear to be alopecia areata. I've never seen something looking like that is alopecia areata. Is there another type of hair loss that causes a linear type of kind of scar-like appearance in one particular area on the scalp? None that I'm aware of. There are, of course, many rare things out there. I don't know everything, and so perhaps there is. If you guys have heard of something like that, make sure to comment below. But I think something that's a bit more plausible, that again is very speculative, but just I'm going to throw something else into the mix of possibilities specifically for Jada's scar. I think Jada may have had, again, it's purely speculative, I could be wrong, but she may have had a coronal brow lift. A brow lift these days is often done to just address the temporal part, so the lateral aspect of the brow, by making an incision behind the hairline. Also, when you need a complete brow lift, most of the time it's being done through endoscopic type of approaches, whether it's with endoscopes or without, but it's still minimal access, meaning you have 3 to 5 ports, these individual incisions behind the hairline to kind of hide the signs of any type of surgery. In the past, there was a different kind of brow lift, which was a coronal brow lift. There are also other pretracheal types of brow lifts where you're at the hairline, but in terms of what I think Jada may have had is a coronal brow lift, which would be essentially the same exact location where I see that scar. Now, she may have not seen it for a long time until her hair loss became worse. So she may have had hair just covering up that scar, and then as her hair loss worsened, it may have revealed that scar. So she may have been totally shocked. I'm not saying that she's misleading people, but she may have been shocked herself to see, like, oh my gosh, and maybe she didn't realize that that procedure of the past, if she even had one, may have caused that type of scarring. So what are hair restoration options, specifically for women? Because I do a lot of these videos videos, and most of the things I talk about could also, as far as treatments, could relate to women, but I haven't really done a video specifically on women's hair restoration, so I wanted to touch on this here. Now, before we get into those solutions, there are sometimes tests that we do, not just by looking at the scalp. Occasionally we have to biopsy the scalp if we're not sure if there's some kind of scarring or inflammatory condition going on. Sometimes we get lab work looking at things like thyroid levels, iron, ferritin, vitamin D levels, certain types of hormones, and sometimes we look for allergic type of reactions, so sometimes skin testing or patch testing to see if there's something in someone's hair product, for example, that might be causing irritation and other problems. So getting into hair loss options, we have Rogaine, which is a solution or a foam, and we have a whole video just on Rogaine. The generic is minoxidil. Minoxidil tends to elongate the anagen phase of the growth cycle, and by doing so, it can help increase the growth of the hair. All medical therapies, as I talk about on my channel, are temporary solutions, and they need to keep up with them in order to continue to see the impact of all these medical therapies. Then you have finasteride, which is Propecia. Propecia is the brand name. This is a 5-alpha reductase inhibitor. This will reduce the amount of that dihydrotestosterone, or some of those androgens that I talked about earlier that are circulating, that are causing the miniaturization. This reverses that process. In women, you have to be very careful with the use of finasteride because there could be some birth defects, especially in male fetuses. So generally, it's only recommended for postmenopausal women. Spironolactone is another class of medication. This is also anti-androgenic. It's actually used more often in women for like acne, for example, but you have to be careful also here with electrolyte imbalances. But spironolactone has been shown in studies to promote hair growth. Then you have vitamins, biotin-based vitamins like Viviscal and Nutrafol, and those are B-complex vitamins that have been shown to strengthen the hair and improve the situation in many patients. And you have low-level laser light therapy, and you should check out our video on that as well. These are devices that increase blood flow to the area. They're caps or combs that are worn on the head, and they help stimulate hair follicles. And then you have steroid injections, or topical steroids too. These are for situations where you have a lot of the inflammatory type of state or very active shed with telogen effluvium, and you're looking to kind of halt that shed. Sometimes steroids can be injected into the scalp in a temporary way, can help slow down that process. There's also PRP, which is platelet-rich plasma. These are injections. You get some blood from the vein, you spin it down, isolate the platelets, inject the platelets that have growth factors into the scalp to help promote hair growth. So we'll have a video specifically on that coming out the next month or so. Sometimes fat injections are done, so just like fat transferred to the face, fat can also be transferred to the scalp, and that has stem cells, and it can promote the hair growth to sometimes a nice degree, and can also be done prior to a hair transplant to try to improve that underlying kind of fertile bed for the transplants later. And again, most of these medical therapies are improving that balance of the terminal hairs to the more villous hairs. So they're shifting the balance away from villous or miniaturized hairs to more mature looking hairs. Rarely are they increasing the overall density of your hair, but they are usually helping to promote the increased thickness of the hair and the length, and that all helps. Other classes of things can be done for hair loss are scalp micropigmentation, referred to as SMP. I'll be making a video specifically on this, but the idea here, it's like a temporary tattoo. It's usually little tiny dots that are done on the scalp, and that's called SMP, scalp micropigmentation. It lasts about 3 to 5 years. It's an option for essentially camouflage of a lighter type of scalp. When you have darker hair, lighter scalp, you have that shine through, so it helps. Surgical hairline advancement, or SHA, is a technique that's used to lower hairlines. This is in women who, or men who have very, very stable hairlines and are looking to lower the entire hairline. So if you have a condition like frontal fibrosing alopecia, for example, you don't want to be lowering that hairline because there's a strong chance that those hairs won't survive, and then you have a scar across across the front of your scalp. Another way to lower the hairline or just fill in different areas of the scalp is with a hair transplant. And we talk about sometimes, well, when is it safe to do a hair transplant? What are the conditions? So naturally, high hairline or someone with these frontotemporal recessions could be a candidate. If you're looking to correct different scars, and remember that because that's going to come back as we talk about options for Jada. Correction of scars can be helped with a hair transplant at times. Slowly progressive hair loss, you have to be careful because you don't want to do a transplant and the person ends up losing a lot more hair, so you have to stay conservative if they're slowly continuing to lose hair. Scarring alopecias or alopecia areata, if there's a circular area or an area of scar from, say, like lichen planopilaris, which is this inflammatory state that can cause some scarring, you want to make sure there's stability there over the course of years prior to a transplant, and occasionally we'll do what I mentioned earlier, a fat transfer prior to a hair transplant in those areas. You want to make sure also that there's good donor area. When you're doing a hair transplant, you're borrowing from one place to put to another. The place that you're borrowing from has to be good hair, has to be able to donate, and you want to make sure you don't exhaust that donor supply. You also want to make sure patients have realistic expectations when it comes to their potential results. So what can Jada do now about that scalp scar? So one is you can own it. I mean, she's at least brought it out to the public. Maybe it's not the most factual representation of what put that scar there. However, she has talked about it and she could just do nothing, right? That's always an option. Another option would be a wig or a hairpiece or some sort of cover-up, which I'm sure she's tried before. There's scalp micropigmentation, so it's the illusion of hair. So it's flat, it's not three-dimensional, but it can still be a reasonable option for scalp scars at times. There's scar revision, so sometimes you can surgically cut out a scalp scar and then try to resuture and hope for a much thinner scar. There's always going to be a scar, but a much thinner, less obvious one. That's an option. And lastly, a hair transplant into that scar could be something useful, assuming that she has some reasonable donor hair, say in the back of the scalp. But with all the other types of issues with her hair that she's experiencing, she may not want to do anything about that scar and just let it be and hope that, I guess, people just forget about it. I hope that helped you guys understand more about women's hair loss and hair restoration options, and also a bit more about Jada Pinkett Smith and her hair loss situation. Make sure to please check out our hoodies. They are all about body positivity, with proceeds going to the Alopecia Areata Foundation, incidentally enough, and very much related to this talk. So hopefully you guys enjoyed that summary of things that can be done for hair loss, things that Jada Smith could consider for her own hair loss. And if you've enjoyed this video, please make sure to check out our video on eyebrow hair transplants, and we included Chrissy Teigen's experience into that video. It's also a patient of mine that I share as a showcase video, so click on the card. I'll see you there. Thank you so much for watching. I'm Dr. Gary Linkov, signing out.